My name is Lisa Salberg. I am not only the founder and CEO of the Hypertrophic Cardiomyopathy Association, I've been a patient with HCM since I was 12 years old. My family story can be found elsewhere on the website, and that's not what I'm here to talk to you about today. I'm here to talk to you about being newly diagnosed. And we've all been there. Anyone who is living with a diagnosis of HCM has gone through the exact same feelings that you may be going through today. Whether they be 4 or 5 years old when they're diagnosed, or they're 12 years old like I was, or they're 40, 50, 70, 80 years old. When you're diagnosed with a problem with your heart, you get scared. And first I want to talk for a moment or two about fear. Fear can be debilitating. Fear can paralyze you into inaction. And fear can literally be the difference between life and death for some people. I encourage you to move past fear and move to action. HCM, while it can be a scary disease, and it has a really nasty reputation, is, for the majority of us, really just a chronic medical condition that needs to be managed. While yes, sudden cardiac arrest and sudden death occur, those numbers of people are very small, and we've gotten much better at identifying who might be at extensive risk and treating them properly. So the fear should not be in the disease. The fear should be in inaction or not getting to the proper medical attention, which sometimes can be a battle. So let's talk a little bit now about all the things you're going to read. You are not going to be every picture of HCM out there. We are all unique individuals. We all come to our diagnosis of HCM for different reasons, and we come with different bodies, and we come with different other medical conditions, and we come with some good news and some bad news. If we're already battling with things like weight management, diabetes, hypertension, HCM does not work well with that. We really want to fight very hard to get these other issues under control. If we've come to the table with only a diagnosis of HCM, we want to work to maintain that. We don't want to develop hypertension, diabetes. We don't want to develop any other types of medical problems that we can control. So I encourage you to all adapt a healthy lifestyle, not sit on the couch, but get out and move. Talk to your doctor about a plan for you that you can keep moving, that you can keep active. No, we're not going to be competitive athletes. But there's a lot more that we can do than we can't do. So focus on that. Like I said, you're not going to be everything you read. You're not going to be a patient who needs all of the treatments we have for HCM, like a myectomy or an alcohol ablation or an ICD or a pacemaker or a transplant. We all fit into little niches. We've all fit into little areas of HCM. Most of us are managed with a mild cardiac medication. About 25% of us will need implantable defibrillators. About 5% of us will move to heart transplant at some point in our process. It takes a while normally to get to these places. So how do you figure out what's right for you or your child or your loved one? You need the right doctor. I am very well aware about what I'm going to say. May get me in a little bit of trouble with some people, but I've been at this for 16 years. I've worked with over 5,000 families. I've seen what works and I see what doesn't work so well. With all due respect to the cardiologists of this world, they see very little hypertrophic cardiomyopathy in their day-to-day practice. And because of that, they don't understand the disease fully. And I wouldn't expect them to spend a great deal of their education and time learning about a disease that only affects a small percentage of their total patient population. But I do expect them to refer. And the new American Heart Association guidelines on the treatment and management of HCM specifically discuss HCM centers of excellence and getting to quality care in high-volume programs. A list of those programs can be found on our website. seeking care from a community-based cardiologist, pediatric cardiologist, or electrophysiologist is part of your process. You need them on your team. We really need good, strong relationships with these people. But you also need a tie-in with an HCM Center of Excellence. You go for an evaluation, you make sure you are current with the latest understanding of the disease, treatment, and management. These centers have literally met the difference between life and death to thousands of our members, and we want to see them grow. You need to get into a program, get evaluated, work with your hometown cardiologist in partnership with this center to ensure that you're getting the best care possible. Now, some people will say, well, that's a lot of work. I have to travel. Well, if you can go to Disney World and visit a mouse, you can get on a plane and go visit a doctor. It's your health. It's way more important than a family vacation. And you need to put it on your priority list of things to do. So finding the right doctor for you is not necessarily based on location. It's based on personality. It's based on specialty. It's based on what you seek out of the healthcare relationship. But you got to be proactive there. So my last thing to tell those of you who are newly diagnosed is that this is a marathon. It is not a sprint. You're likely going to live a very long time with your diagnosis. And because of that, I don't want everybody to start panicking immediately and think that they have to rush to therapy. You've got to make careful choices with the right people and be very logical about this. While this is a very emotional issue, it's your heart, you really want to be careful about jumping into procedures, jumping onto medications, jumping into devices before having a very thorough evaluation and getting input from people who really know the most about this disease and can help you chart your course. So where does the HCMA fit into all of this? Well, we've been here for 16 years, servicing patients and families with HCM and also helping to build HCM programs around the country. When we started our work, there were 3 programs that specialized in HCM, and today we're working towards number 30. So we're trying to get those centers a little bit closer to you so you don't have to travel quite so far for care. But right now, you may have to travel. We encourage you to get involved with the HCMA and help us spread awareness about what this disease is, that we are the face of heart disease. Even though we look relatively healthy, we are, in my case, battery operated. We've had heart surgery. We've been out there fighting this fight for a long time. HCM is a genetic disease, so it does run through our families in most cases. And that's a bit of a burden for us. And we need to know that we're not alone. So we have a message board community that can help you communicate with people. And they're coming from all walks of life, all parts of the United States, all parts of the world, really. And they're going to share their experiences with you. Not every one of their experiences will be exactly like yours. Some are really not very positive. Some are incredibly uplifting. So I encourage you to read through, share your thoughts and opinions and your battle and your maybe not so much of a battle with HCM. We are here to help you have a successful life, managing your HCM and ensuring that you get the care that you need. And if that means we have to write to insurance companies to make sure you get to the programs that you need, we have to file appeals with you, we have to hold your hand while you're making those appointments, we have to help you understand what might be the right options and give you questions to go back to your doctor with so that you can talk this out in a logical, educated way. That's what we're here for. So I welcome you to the club you didn't want to join and tell you that you are certainly not alone. So stay tough. Call the HCMA. Phone number is 973-983-7429. Give us a call. We'll talk it out with our staff, and we'll make sure that you're on the right path and that you and your families get the care that you need and deserve. Be healthy, be well, and stay in touch.